Hi, Dr. Tim Clare with South Charlotte Disc Center and Pro Health and Wellness in Charlotte, North Carolina. Just giving you a little bit of information. We're doing a little bit of an interview with Thomas. Thomas is our new member of our staff working with us as far as massage, and just kind of going through a question and answer. And we're going to do a series of these. So if you have questions for us that you'd like us to answer, maybe about how massage is handled for certain situations, or what are some of the great things that you've seen in the past that are more difficult cases, let us know. That's kind of what we're doing this for. But to introduce Thomas, why don't you tell us a little bit about yourself, your background, what you like to do, maybe some of your focuses for massage.
Thank you. First of all, I appreciate you having me here. It's great to be part of the team here. I guess my background has always been more of a clinical approach to the craft. Sometimes people need relaxation, and that's fine, and we can completely provide that. De-stress in this hectic world we live in is a big deal. But really, my passion, as I went through my career, has really been, how do you put your hands on somebody compassionately and create change? How do you use your hands to fix a problem? And I've always found that to be very rewarding when you get to that point, when someone walks out of the room better than they walked into the room. So I've always approached massage as an art and a science. It's a science in that rules apply. There's certain ways you have to do things, but it's an art in that the more you practice, the more proficient you become, and the more you hone your skills and your sense of touch and, dare I say, intuition. And that's probably that way, I would assume, with any body work. The more you practice, the more proficient you become. I've been blessed to be practicing for 19 years, and I really enjoy a more therapeutic approach, and I enjoy working with other therapists and other modalities to help reach people's goals.
Awesome. Yeah, it's fun. One of the cool things that we've kind of known Thomas for a little while, and we've referred back and forth, and it's honestly one of the beauties of having him on board is we've had so many compliments about the work that he does, and it helps me with what I do. So we're happy to have you on board.
Thank you.
Yeah. From my standpoint, from a chiropractic standpoint, and from working into sports medicine side and disc decompression work, we know the benefit of utilizing massage within our protocols. And so, like you said, from working into the muscular side, working into any type of body work, it's that focus on how are you going to make that person's life better. And so that's the reason why we do what we do here. It's great to have another tool in our toolbox of utilizing massage as part of our component for care. Just like what we use disc decompression for discs that are herniated, bulging, or arthritic, or we're using knee decompression to try to keep people from having to have knee surgery. Posture and balance stuff, those issues are huge today. Harvard's come out with some major studies about the amount of people that end up, unfortunately, going down that path from going to the ER, going into rehab services, and unfortunately not coming home. And that's not always an old thing, but a cognitive function thing, and how the brain works with the body. So we're always looking for ways, and that's kind of been my focus within practice too. How can we better help people, leave here in a better place than where they were before? So cool. So this is our first installment. We're going to do multiple ones. Again, if you have questions or concerns, anything that you want us to answer, we love the feedback. So again, it's your future. Be there healthy.